Hey, is shoulder surgery the best option for your shoulder? There's some things that you should know, and the answers might just surprise you. So hey, I'm Shelley, and I'm from Miami Physiotherapy and Lakelands Physiotherapy. Now this has been something that's come up quite recently, and it's been discussed over the last few years since a few different studies have come out. But what we're talking about is the best treatments for subacromial pain. So I'm going to show you on Bob. Remember Bob? So this is Bob over here. So Bob's got some fairly lax shoulders, as you can see. You see this space in here where I've got my finger. So this is where some of the rotator cuff tendons goes. This one would be your supraspinatus muscle, comes through and attaches through and onto this bone here. Same thing with the infraspinatus at the back, comes through, attaches through here. So you can see here, there's not a lot of room in this section here. So what sits in here is tendons, we've got bursas, and we've got ligaments in here. So if you've got problems with any of these structures, so the tendons, the ligaments, the bones, if you've got some spurring or arthritis in there, or the bursa itself, then you're going to have less space in there. And then every time you lift up your arm, it's going to potentially get a little bit pinched, and it's going to cause pain. So let's look at some of the research. So back in 2017, some surgeons did a study where they looked at the surgical treatments comparing to what we call sham surgical treatments and also no treatments in patients who had subacromial syndromes. This is pain in this section here. So they literally did a subacromial decompression where they carve out a little bit of this structure here, make more space. On some of the patients. In one of the groups, they did sham surgery. So they stuck some holes in there, stuck the cameras in, but they didn't actually correct anything. Or there was a group of patients who they did nothing to. And surprisingly, what they found, there was no difference between all three groups at the 12-month mark. So as you can imagine, that made a whole heap of surgeons not very happy, and it started to question a couple of things. So whether surgery was the appropriate treatment for these sorts of patients, but also whether the structures that we think as causing the pain in the shoulder were actually to cause. So this has led on to a second study. So there's been a lot of studies in the meantime, but this next study in 2018 was a really good one as well, where they actually looked at therapies. So now they've looked at physiotherapy treatments in two different protocols. So the first one they looked at, similar protocols, the difference being one group of people exercised into pain, whereas the other group of people didn't have any pain. So they looked at the outcomes over this. Unfortunately, they only did a 4-week protocol, but at that 4-week mark, they found that there was, again, no difference between the two exercise groups. So this has then questioned, from our perspective as therapists, whether it's okay to exercise into pain. And this study would say yes, it is okay for patients to exercise into a comfortable or an acceptable level of pain. So this is a really important step to know in this sort of exercise group as well. Okay, so this brings us to a third study, which was conducted just recently in 2019, or reported in 2019, where they've compared the physio intervention for people with, again, subacromial syndrome with no full thickness tears with surgery. And what they found was that at the 12-month point, physio treatment was just as effective for both pain and for function as the people who had the surgery. So, what does this all mean? So what this means is that if you're a person who is suffering from a subacromial syndrome, whether it be from any of those causes there, a lot of these people may actually benefit really, really well and do great with just physiotherapy over a 12-month period. So some people might have to have surgery, that's correct. But for the majority of the people, the recommendations now are do 12 months of physiotherapy, and it needs to be specific physiotherapy here. So not just anything, you need to do specific targeted physiotherapy using a tendon-loaded program that is going to actually sort out this issue. If at the 12-month mark you're still having some issues, then you can consider surgery. There are some cases where we'll recommend surgery earlier, but for the majority of the people, 12 months of physiotherapy first should sort out this problem. So if you think that you're having a problem with your shoulder, and it might be a subacromial syndrome, whether it be a bursitis and tendinopathy or a ligament or an arthritis problem, that is something that we can definitely help with. So give us a shout if you want, book in to see one of our physios at Miami Physio or Lakelands Physio, and we can assess your shoulder and see if this is something that we can help you with.